Hello and welcome to Foundations in Continuing Education, presented by the Commission on Accreditation for Pre-Hospital Continuing Education. As partners in continuing education, CAPCE joins you in your effort to provide the highest quality learning experience for your customers. We work together to improve patient care and advance the field of pre-hospital emergency medical services through education. This new resource is designed to facilitate and enhance that effort. We recognize that not all providers employ staff with credentials and expertise in educational methods. This video series is designed to provide a theoretical, knowledge-based, and practical how-to strategies aimed at raising the professional educational quality of your programs. The ultimate goal of continuing education is to encourage and facilitate a commitment to lifelong learning. As former India Prime Minister Gandhi once said, "Live as if you were going to die tomorrow, learn as if you were going to live forever." At CAPCE, we believe that continuing education done properly, either in person or through effective online activities, is the lifeblood of our profession and the conduit through which EMS will grow in credibility and stature within the overall healthcare industry. For crews who provide emergency medical services to their communities, failure is not an option. The stakes are too high, and there's no such thing as good enough. Providers of continuing education must offer learning opportunities that not only inform their customers, but also inspire them to learn as much as they can for as long as they can. But they can't do it alone. Practitioners, Con Ed providers, and CAPCE must become partners in this lifelong journey toward excellence. This is a true team effort. Probably the most important principle guiding the existence of continuing education is that graduation day marks the beginning, not the end, of a practitioner's education. We believe that working together to provide relevant, current, educationally sound continuing education activities ultimately leads to improved patient care in the field. To this end, we must all dedicate our mission. Continuing education is a specialized branch of education that comes with a unique audience and a specific set of objectives and strategies. Unlike original education, students taking Con Ed courses are already familiar with the subject matter. In addition, their knowledge bank is enhanced through actual experience, assessing and managing real patients in real time in real-life situations. Since their needs are much different than original students, the strategies we use differ as well. There are 3 simple rules for providing continuing education programs. 1. They must refresh previously learned knowledge and skills, with special emphasis on problem solving. 2. They must provide information that is relevant and reflects the current best practices in emergency medicine. 3. They must inspire students to make continuing education a lifelong commitment. As a continuing education provider, we've made the commitment to provide the most effective means possible for students to continue their education. These activities should be aimed at 3 specific and different targets: the past, the present, and the future. First, the past. Unfortunately, we are all subject to the laws of knowledge and skills erosion caused by time and infrequent use. Because of this, we have to refresh our knowledge base and skills proficiency periodically to combat this erosive process. Again, there is no such thing as good enough. Reviewing previously learned material, such as relevant anatomy and physiology, pathophysiology of disease, injury patterns, emergency pharmacology, patient assessment, and field management are all necessary and important. Practicing rarely used skills such as traction splinting and cricothyrotomy are equally important. The key is to review these essential items not by themselves, but in the context of problem solving. Our focus should be to enhance their clinical judgment by using activities which allow students to apply what they know to assess and manage patients. To this end, activities such as scenarios and simulations are invaluable. Second, the present. Because evidence-based medicine is rapidly changing our practice, when we focus on the present state of pre-hospital care, we must include any and all changes that have become the standard of care. The two most recent examples of radical changes in care include limiting oxygen use to those patients with lowered saturation readings and no longer recommending long backboarding for anyone with a remote possibility of neck injury. Agencies that have not modified their courses to reflect these changes are recommending practices that are not only outdated but harmful. We must always provide students with the best current field practices. Finally, the future. We must convince and encourage students to continue their education beyond their certification or license level. Providing current, relevant citations inspires students to dive deeper into the subject matter. Teaching advanced assessment techniques such as ultrasound, new point-of-care testing devices, and using imagings such as X-rays, CTs, and MRIs to teach anatomy are excellent examples. These type of activities encourage students to do what we want them to do, to continue their education. The principles and best practices described in this video series are based on those found in every institute of higher education. The CAPCE standards are based on those best practices and are aimed at helping providers comply with the standards outlined in the 2020 CAPCE Accreditation Manual. And together we are raising the bar of continuing education in emergency medical services. For students, continuing education is not about passing a test. It's about making the commitment to provide the highest level of care possible. For COD Ed agencies, it's about providing the highest level of continuing education activities. CAPCE looks forward to working with you to achieve these goals. Our strategy is to combine old school educational values with new age technology. We hope you find these videos helpful in doing just that. This video series contains the following modules. 1. Performance objectives. 2. Lesson design. 3. Summative testing. 4. Curriculum alignment. 5. Gating.